This is Dr. Selene Parekh, the Fantasy Doctor. We've been getting a lot of questions about Kevin White's tibial stress fracture and what it really means to have that surgery that he will be undertaking sometime this week. So let's take a closer look at the board and get an idea of what's going on anatomically. So this is the look of the legs, both on the right and on the left side of the human body. That's your knee. That's your leg bone, also known as a shin bone. There's a second bone here, a little bit smaller, and then it comes to your ankle. Kevin White has a stress fracture, likely in this part of the tibia bone. Now, this area has a poor blood supply, and if you get stress fractures, over time, if it's not treated and doesn't heal appropriately, you can develop a little crack right in the cortex or the shell of the bone. When that happens, orthopedic surgeons such as myself will place a rod from the knee down through the entire shin bone and lock that nail into place with 2 screws in the far part of the shin bone and 2 to 3 screws up in the top part of the shin bone. That allows the tibial stress fracture to then be more rigid and then allows it to have a chance to heal. In addition, the stress fracture area is usually cleaned out and packed with bone graft to allow that to heal. What that means for Kevin White is that he is out for at least 2 to 3 months, if not the entire season, depending on how fast he heals, how fast he can get into rehabilitation, and how quickly he can get the mobility, agility, and strength he needs to play back on the NFL. I would look for him to be perfectly fine for next preseason, but I look for him to be out for the majority, if not the entire portion of this season. This is Dr. Selene Parekh, the Fantasy Doctor.